If you use cannabis frequently and you can't stop throwing up, you might be surprised by some of the spicy treatments that your doctor provides. You've probably heard that cannabis helps with nausea, but some long-term cannabis users end up in the ER vomiting uncontrollably because of something called cannabis hyperemesis syndrome. This is something that I see in the ER quite frequently, living in BC where weed is legal and seems to be more socially accepted than smoking tobacco or drinking alcohol. And it's a pretty interesting paradox because cannabis is supposed to stop nausea, but in cannabis hyperemesis syndrome, THC actually triggers nausea, uncontrolled vomiting, and abdominal pain. So why does this happen to frequent or daily cannabis users? Well, we're still kind of figuring it out, but currently the leading theory is that chronic THC exposure messes with your brain's vomiting control center and also your gut's cannabinoid receptors. And over time, instead of calming your stomach, THC starts to trigger it. One of the hallmark signs of cannabinoid hyperemesis syndrome is that hot showers or baths are the only things that seem to alleviate the nausea. This is thought to work by activating the TRPV1 receptors in your skin that detect heat and pain signals. And when these receptors are stimulated, they send competing signals to your brain that can override or distract from the pre-existing nausea or vomiting signals. So typically how we treat this in the ER is with IV fluids to treat for dehydration, anti-nausea medications, which are actually not the typical medications that we would give for something like a stomach bug. And instead we give drugs like haloperidol, which was initially formulated for things like psychosis or schizophrenia. And sometimes we'll apply capsaicin cream to the abdomen, which is essentially just chili pepper cream, because this acts in the same way that hot showers work by activating the heat and pain receptors. But the only true long-term fix is by stopping cannabis use. So if you're a regular cannabis user and you end up in the ER because you're vomiting, it might not be a stomach bug, and the cure might be a combination of chili pepper cream and giving your body a long break from cannabis.